everybody. Finally, took a bit. I'm sorry, a little problem with our audio. I hope everybody can see us. Give us a 5-5, please.
I'm getting, no, Bella.
What?
I'm getting feedback.
Oh, did it start?
Yes.
See, here.
There we go.
Can I go now?
Now you can go. Go ahead.
I can go outside?
Yeah.
Wait,
That's my
I have
12-year-old.
to.
That's our
I
dog.
have.
That's my technical support and my production team.
Could be swimming right now. And then.
So.
Okay.
Thank you.
Goodbye.
So can you all hear us both at the same time? A lot of background noise.
Sorry, I have a Pomeranian who's being escorted out of the building.
So, hello everybody. Glad that you're all here. I can see Princess Palm Beach, Laura, Yuvanda. Everybody's here. I can see Son of a Green Card made it. And Judy and John and KB. I'm glad. And Adam. Hello. Kate is there. I'm so glad. Rook, our favorite.
What's up?
Finally, we have our Rook here. And yeah, I'm on a different place now because I was actually, I changed my location for a moment because, well, I wanted to. And so today we're going to talk with Rook about what she does. And so let's first introduce you, because obviously everybody knows you from the chats. Maybe you can tell a bit about yourself.
Thanks, Keystone. It's a pleasure to be here. Everyone probably knows me as the loudmouth in the chat, so hopefully I won't disappoint. I'm a licensed acupuncturist. I've been in practice for 15 years. I have a license in the state of New Jersey and in Hawaii. And I'm a diplomat of Oriental medicine. So I'm certified by our National Certifying Commission for Oriental Medicine and Chinese medicine. So I studied not only Chinese herbology, but also acupuncture. So
my voice is, wait, sorry. Hang on. Okay. Is it better?
Oh my gosh, that's much better.
Yes.
Yes. That's great.
I know what's going on. I put mine.
I know Mercury's not in retrograde, but they're still messing with us.
Oh, guys, give me a 5-5 if my volume is better for you as well. Hello. 5-5, please.
There we go. Yeah.
Yes.
Nice.
Chat. I think the chat is for me. It's stuck. Is it?
It's going slow on my end, but.
Okay.
So Keystone and I had this plan for a very long time, right, Keystone? This has been in the works for a long time. Yeah. So it's a pleasure to be here. It's an honor to be here. And I just want to say thank you for the opportunity. This isn't really something I ever really envisioned myself doing or planned on doing, but it's a great honor. And I want to thank actually all the content creators, because I always call myself a content consumer. And if it wasn't for, you know, Red Pill, Methods, White Hat, we wouldn't be part of this incredible community. And especially our female content creators are just absolutely amazing. Shout out to the Pink Patriot Hour. Just incredible women, beautiful women, intelligent women with so much to offer. So again, it's really an honor to be here.
Well, I'm very glad that you're here. And is that White Hat? Is that, does he have a different? Yeah, he has.
I don't think White Hat has a wrench. He's been demoted.
He's been demoted. No.
That's because actually he hasn't gotten back to me about him adopting us. I told him that we were sisters from another mister, and we come as a package, and we can't be separated because one of us will get in the system. So he's getting back to me on that.
I always try everybody to adopt me, but yeah. So yeah, I'm so happy that you're here because actually she's saving my ass today because I slept an hour, but wonder I still look pretty fresh for somebody that just slept in the last 48 hours, just 1 hour. And okay, yeah, you can change Count Whitehead.
You're like the Energizer Bunny, Keystone.
Yeah, me. Yeah.
Yeah.
I'm constantly all over the place. And yeah, there he is again.
And you also had a magnificent plan to just mesmerize everyone with your beautiful hair. So I think it's working.
Oh yeah, because I thought I'm going to look so tired. So I'm going to.
There you go.
But so today, I was, I asked her to come on today because, Healing Wednesday, it is today. And we want to know what, obviously I already talked to her before. And because I have the plan with the website to make all these different modalities for people to help them in their journey to healing. And she's going to be part of that. And so she's going to tell about what she's doing, all the different things that she's doing, hopefully in a bit of layman's terms, as you can see. And then, we'll tell a bit about that.
Yeah. I love to explain acupuncture to people because I think it's important that we demystify it. I always say it's, take it out of the giant, out of the mountains. Acupuncture is wonderful for musculoskeletal pain, particularly. How it works essentially, wherever you stick a needle, it creates an immune response. So basically your body will recognize the needles as foreign objects. They're not supposed to be there, and it triggers a whole cascade of immune responses that are actually very beneficial to the local area for pain. So as soon as a needle goes in, the body will send pain modulators around the site of the needle. It thinks it's being attacked by these little foreign invaders. Now, there's nothing to fix or repair. The needle is so fine, it's like a blade of hair. It can maneuver around vessels underneath the skin. So generally there's no bleeding, no bruising, nothing that would normally trigger an immune response like this. So in essence, it fakes out your body's healing response. And it's a way to get a targeted immune response happening in an area. And that's considered the local reaction. So if you're coming to me for back pain, neck pain, headaches, I go to those local areas particularly to get that kind of response. Now, systemically, what happens, regardless of where you place a needle or, maybe what you're coming in for, the body just physiologically responds to the needle by releasing brain chemicals. So one of them is serotonin. We all love serotonin. Serotonin is a neurotransmitter that makes us feel a little bit more content, a little happier. A precursor to that is tryptophan, and you might have heard that makes you feel a little tired and sleepy. So same thing with acupuncture, almost as a side effect, you should notice improved quality of sleep. It's great for insomnia. It's great for stress reduction, relaxation for those same reasons. And lastly, it releases endorphins. So say you did something physical, you went to the gym, you worked out, and you just felt good because you were active. The endorphins actually allow you to tolerate pain better. So that's kind of from the more Western perspective of how acupuncture works and what's happening on the different mechanisms. Obviously, it's wonderful as an analgesic, and very interesting studies show that kind of, related to, say, taking an opioid, we don't have the similar effect, in terms of maybe inducing nausea or things like that. Actually, quite the contrary. Acupuncture has been very effective to control and reduce nausea, whether it's pregnancy induced or chemotherapy induced as a side effect. So from the Eastern perspective, we always look at pain as something is obstructed, something is stuck It's not flowing properly. There's stagnation there. So I always compare the acupuncture needle as like if you have a garden hose that has a kink in it, the needle is there to help remove the obstruction to allow for this free flow of energy, blood flow, nerve conduction. And they say, when things flow, there'll be less pain or no pain. So, we always look out for these blockages, obstructions, and stagnations in Chinese medicine. So.
Oh, is it that as soon as you put the needle in, it does hurt, but when the hurt goes, that's actually when the energy is flowing again?
So, I try to insert needles as painless as possible. And, it's always funny because at the end of the day, I'm like, I am sticking a needle in you, so some you feel, but I honestly, I can get a couple in. Usually people don't even realize that they're in. You should feel something. And, there's a difference between, we see traditional practitioners that like to use a thicker gauge. They think it's good when you feel something. American patients tend to be like, what? I don't want to feel anything, So I always try to find a happy medium of being effective and being as painless as possible. So you should experience sensations around the needle. What we call is the de qi, which is the arrival of the energy. So sometimes it happens purely from insertion. Like I'll just hit the bullseye. I see as the body responds to the needle, it can actually jerk and pull the needle down and contract the muscle, almost like I compare it to like a fish on a fishing line. You can see it tug, and the patient will be like, oh, wow, I got an electrical sensation, or I felt that go from my knee all the way down to my foot, or, you put it over here, but I feel it over there. These are all some of the energetic sensations that are very good for, treatment. We want to encourage sensations like that. What I don't like is, a needle sensation that just feels sharp and doesn't go away. If something is like that, I always encourage patients to let me know. I either reposition or take it out completely, because ultimately you should be as comfortable as possible. You shouldn't feel much of anything at times. You can feel a heaviness, a dull, achy quality, and itchiness, which is very common when we talk about that immune response happening around a needle. You can actually be aware of that sensation happening if you're sensitive to that. And also you can see almost a redness sometimes appear around the needle. But laying there, you should be quite comfortable. You shouldn't be feeling too much of anything. If you go to move, which it's perfectly safe to move, you could get up and walk around with acupuncture needles in you if you had to. I don't encourage it, but you would then maybe feel the needle reposition a little bit more and feel something. But for the most part, you should be quite comfortable laying there.
And so it's exactly the same as the Chinese. You just practice it obviously in the West. So
yes.
So
many different modalities, there's Japanese style, Chinese style. We do a lot of ear points. French have contributed to that a lot. And then from there, several offshoots where it just incorporates so many different strategies and comes down to the art of practice, essentially. A lot of variety there. We choose points based on function of points. So it'd be quite interesting. I might be treating somebody's eyes, but I'm putting a needle by their toe and they're like, right. My problem's up here. Or like, what are you doing down there? And it's very interesting under thermal imaging. There's a point down in between the toe. It's a webbing, actually, it's a very famous points, webbings of the hands and webbings of the toes. We call them the four gates. Has an effect over the optic nerve. So, which relates again to our theory. And it's very interesting to see the blend of where Chinese medical ideology, I guess, and Western medicine come together. So we think of that as on the liver channel. The liver has to do with the eyes. Liver is a yin-yang pair with the gallbladder. Gallbladder also, if you think of jaundice and things like that, appear in the eyes. So there's a lot of overlap that is always fascinating to see that, even though within the realm of Chinese medicine, we kind of speak our own language. The Western part exists, but again, it's kind of our own language. Very important for Chinese medicine is that we observe the negative space, which is a concept that Western medicine has yet to really catch up to us with. The space around an organ is just as important as the organ itself. And, there's, when you think of even the fascia, very important as it holds an electrical charge throughout the body, and it kind of like this shrink wrap around all of your internal organs. And Western science is just like, well, I don't know about the fascia. I mean, surgeons know about fascia because they have to cut through it, but it didn't really serve a purpose. And for us, it does. It always does. The negative space is just as important as the positive space. The solid organ versus the hollow organ. So
the meridians are all the same, right? In every country where they practice acupuncture.
Absolutely. So we have our main, we call them like thoroughfares of energy, and almost all of the meridians run vertically, not horizontally. There are some extraordinary meridians that do run a little bit horizontally, particularly around the waist and things like that. Again, looking back to the electrical charge as it goes through the body, we see that kind of connection. We think that energetic pathway is where the acupuncture points can be found on or near the surface of the skin, and that energetic flow actually dives deeper and connects to that internal organ. So, when we talk about your liver, your spleen, your heart, things like that, a lot of times we're talking about it on an energetic level. There can be a functional part of that as well, where we're actually talking about the function of the organ. But the meridians are very, they're the same throughout all the systems.
Between acupuncture and, for example, acupressure, because you use the same points. However, obviously, needle you go deeper in
Absolutely. So acupressure is utilizing acupoints. And you're right. The only difference is the acupuncture is a more intrusive and more invasive treatment. It is needle penetrating the skin. And, I brought some examples of things if you guys want to see acupuncture needles and cupping therapy, gua sha. Needles can go from very small to very long, depending.
Because the meridians are deeper or less deeper, so that's why
it varies depending on the point, the patient, what the objective is. Like, for instance, there's some needling techniques where, regardless of the size or shape of a patient, they're needling a long needle down the spine on a very thin, they call it threading. So it's a very shallow insertion, but literally almost all the way down the spine. Then you have other patients that are, bigger in stature or whatnot, and you need to get deep enough to actually be effective for that point, particularly if you're going into glutes and piriformis, into the hip. And there's actually times where we touch bone, especially in degenerative conditions. Any circulation that you can get to a bone and encourage blood flow, which is what the needle does, just even by default. Anywhere you put a needle is going to help for circulation. Great for diabetic neuropathy, toes, everything, numbness. But when you put that needle there, it can halt the progression of degenerative disease where it's at, which is wonderful because there's not really much they offer for degenerative disease in the United States. I mean, there's pain medicine, there's surgeries, and they just expect it to get worse as you age. We call it TMB, too many birthdays, right? I mean, it's wear and tear. It's, kind of just getting old, unfortunately. So putting a needle and getting it close to the bone there encourages the circulation, encourages blood flow, and not only help to reduce and eliminate pain, but actually slow or even halt the progression of that degeneration down, which, again, it's a big win when you think of the alternative of things just getting worse and, not having any options for you.
So does this work, for example, also for nerve pain, like when a nerve is blocked, for example? Because I heard something about that, and I was curious, like, if that's like like obviously you have these simple pinched nerves, which
Sure.
I have in my shoulder. That's why I can't feel these two fingers for months now, but I know if I do yoga, then it will be fine again. However, for some people, it's like really, I don't know.
Painful and yeah, very frustrating to deal with, can really limit the quality of your life. So nerve issues can happen in a variety of ways, and we think, yes, we have an effect over the circulatory system, the musculoskeletal system, and also the nervous system. There's instances of pinched nerves that happen actually in the muscle. Like I used to have a police officer who would always have numbness going down, into his hands. Everyone always is like, it's your neck. It's not always your neck. His problem was actually in his pec muscle. And we could isolate it right here and boom, it would go numb. So it can happen within the muscle that it is either swollen, just encroaching upon a nerve, which, is giving you that radiation or that sensation of numbness, tingling, whatever. And then there are the kinds where it is a herniation maybe happening in your spine, some kind of impingement in the shoulder. It can happen from carpal tunnel, even, being swollen, putting pressure on those nerves. So yes, we have an effect on reducing swelling and inflammation, trying to harmonize and regulate. And another beautiful thing about Chinese medicine is we always have this regulating function. We use similar points to treat, say, diarrhea as we would constipation, because it has a regulatory effect over the large intestines or small intestines. So it's really about bringing your body back into balance, finding that, little area where maybe energetically it's off and functionally off, and restoring that, So I have a couple, good.
Modalities or so many functions, because so does it work for a hernia in somebody's back?
It's so interesting. I had a patient the other day who studied with a Vietnamese master. It was in California. He said the master has since to passed away, but he saw him many years back. He said, man, he loaded up my stomach, about 30 needles. He loaded up my back. He hooked me up to an electrical stim unit and literally reversed my hernia before my eyes. He said, this will last you about 10 years. And he said, I kid you not, the treatment lasted about a day before the 10th year. And he said, and I would have done anything. He said, by then he was back in Vietnam. He's like, I would have done anything for another 10 years, So certainly I'm not at that level. I aspire to be maybe one day, but pretty remarkable. When we look at hernias, particularly, we look at, kind of a classification of organ function and dysfunction. So immediately that screams to me spleen and stomach. Spleen has a function of dominating the muscles. It keeps blood within the vessel. Anytime there's any kind of prolapse, whether it's uterine prolapse, whether it's, hernias or even piles, which are, when you, what's the word I'm thinking of? When you have a baby, sometimes you get them, hemorrhoids. So again, prolapse. So it's a weakening of the muscles. Believe it or not, Chinese medicine is also fascinating when you think of the layers. Like you could just keep getting deeper and deeper and deeper with the symbolism and the connections of everything. So every organ has a particular sound and emotion that's, reflective of. So for instance, the spleen has to do also with the diaphragm, and its song or sound is singing. So one way to tonify and nourish your spleen is to sing. And to sing, particularly, how real singers are always like, you got to use your diaphragm and, really have a controlled method of singing. That is a way to actually tonify that organ. Spleen also likes to remain dry. It has a tendency to get damp. So we see that a lot, that spleen also has to do with pensiveness and overthinking. We see a lot of students that we call, spleen chi deficient because of the constant, kind of mental work they have to do, and the worrying and the stress can damage the energy of that organ. So it's very interesting. And sometimes you see it express the emotion in an excess. For instance, the heart has to do with the tongue and talking. And we we consider the heart houses the mind. So a lot of mental disorders and issues involve the heart meridian, the heart energy. When you think of a population that you see maybe outside that are incessantly talking out loud to themselves, we can look back again to those patterns, and it's very fascinating.
Wow, but how is that related to, for example, a hernia? Because you mentioned.
Yeah, so I mean, internal disease, honestly, Chinese medicine is best used with herbal medicine. If you say Chinese medicine to any Chinese person, they're like, oh, herbal medicine. Acupuncture is a little bit of a side shoot of Chinese medicine. And again, best used for musculoskeletal pain and issues. To treat the person holistically, and we always modify. Nothing is like, oh, you got this, take that. It doesn't work like that. It has to be very specific to the person and modified as you go. Would be best treated probably with herbal medicine and acupuncture.
Really? Even if, because, well, I know somebody that has, for example, a hernia in the back, and like the thingy that is in between the
hiatal hernia or something.
And that is like kind of broke.
I mean, in her case, if it's causing major dysfunction or, digestive issues.
No, yeah, literally the hip completely stuck and painful, nerve pain. Yeah.
It's quite complicated. I mean, if you can find an experienced practitioner that would have success with that, it's worth a try, but at the same time, you have to be very smart and careful. Abdominal obstructions can be deadly. If she starts vomiting, she should run to the hospital and not go in the bathroom. Don't run to your acupuncturist, run to the hospital.
In the back. How is that related to a hernia in the back?
You're talking about a lumbar herniation? Are you talking about spinal herniations? Oh, spinal herniations, yeah. There's a couple, there's a variety of herniations. Believe it or not, there's even something called a lumbar fascia herniation, which if you look at someone's back, we call them the eyes of the back. There's where you might have dimples there. There's a lot of times people have what we call a back mouse. I don't know how it got its name, but it's almost like a little lump there. 10% of the population have that without any kind of trauma. It does happen from kind of overdoing it or exerting yourself too much. What can happen is there's literally a herniation in between the sciatic joint, the sacral iliac joint, and it can bring with it muscle, tissue, and nerve. And very interestingly, that can give you sciatic pain. And so again, you go to the doctor and they're like, oh, sciatic pain is coming from, your spine. It may not be. It could be coming from that type of herniation. Most commonly is, yes, Keystone, the, spinal herniations. That is kind of a series of progression, say from a bulge. A bulge starts with the little, kind of disc in between the vertebrae, getting a little squeeze, and that can happen from compression. It can happen again from traumatic injury. It can happen from getting older, degeneration. So the bulge can turn into a herniation. A herniation is considered a permanent condition. Herniations don't tend to go away on their own. That being said, I always say if we were to randomly MRI everybody, those findings aren't always an indication of pain. So we might find people that have herniations that don't have pain associated with them. And we have patients that, have pain associated with them. So how the acupuncture can help with that. And I see a lot of this because I work in an orthopedic practice. So pain is my bread and butter all day long. And whether patients are post-op, pre-op, don't want to have surgery, we see a lot of degenerative disc issues, herniations, and bulges, you name it. So what it can do, especially for the radiation of pain, is very effective. So you don't realize how everything is so connected, and what can happen is the muscles around the area. Your body, in its own wisdom, always tries to strengthen muscles around an area that's weak or has been compromised. And it sounds really great, but it can also cause you problems because now you have these tight, stiff muscles that are trying to strengthen but can be painful. So the first thing to always come off is going to be any radiation of muscular pain, whether it's pain going, running down the leg, that kind of thing. The herniations themselves, we think, can flare up and kind of reduce. So needling near there, again, encourages that blood flow, encourages circulation, encourages the immune factors in that area, and pain modulators will help to reduce it. Now, that might be palliative, that might be temporary. They might leave and be like, man, I feel great. And then, 3-4 days later, they're like, yeah, it's starting to come back again, dependent on use and things like that. So,
because if it's damaged, then you cannot, then it will always, you cannot what you call it, reverse it once it's damaged.
No, it's really hard to get it to go back in there. Some people love traction. So there's the inversion tables. I have a yoga trapeze. I hang like a bat. And that can help too, because you want to create room. Yeah. You have a lot of times, even from just sitting, there's compression. So it's a constant hey, okay, reminder, elevating your spine, staying in alignment, creating that space. It depends on what the patient's goals are. Are they say, I don't care what my MRI findings are, I'm never going to have surgery. I want to do everything I can between yoga, healthy lifestyle, acupuncture, pain management, and I'm okay with that. And that might be okay. Then you have the other patients that they're gung-ho and they want to have surgery, and there might be a disectomy, there might be some kind of fusion, there might be something a little bit more invasive, which, surgeons will tell you if they get 50% reduction in pain, that's a 100% success for surgery. And a patient might say, well, wait, I thought I was going to feel better, all the way better, and so it's rolling the dice. It's always a risk, and I always tell patients you have to exhaust all possibilities, and you have to weigh the most important question, which is pain versus function. If your pain is so high that every day it's 10 out of 10 and you just cannot stand it anymore, or your function is gone, you go to walk and your leg gives out and you fall, or, you can't even do the normal daily routine that you should be able to do, and that's when you have to make those hard decisions. So I'm not that I'm a big proponent of the surgeries, but I see a lot of them, so good and bad.
There are some people that asking questions. So here's Vicky, who asked, what do you recommend for soft tissue and nerve damage if you don't live anywhere close to acupuncture or acupressure?
Funny you should ask. So these are wonderful. Ooh. These are silicone cups. Okay. Cupping, very ancient folk medicine. I've had patients from all around the world, even Ethiopia, say, oh, like grandma used to do. Cupping comes in a lot of varieties. Here's a glass cup. This one we would use fire. We put fire under there and put it right onto the skin, and it creates a vacuum. That you kind of need somebody to do on you. These you can do on your own. So these you can get off Amazon. They're very inexpensive. What you would do, depending on the area, say for your back, you put some lotion, some oil. You're going to squeeze it as you're putting it down onto the skin, and it's going to create a suction. It's going to create a vacuum. Now, there's something called moving cupping. So with that suction, you would then slide the cup to up and down, however you like, into areas where you feel some tenderness, or we do stationary cupping. So you just leave it in place. You can leave it in place up to at least 15 minutes. You can put these on and start doing the dishes, start walking around the house. It's wonderful.
For cellulite, I use them.
You use them? They're wonderful for cellulite. You can do them on your stomach. You can do them on your thighs. You can do cupping on your face too, but you should be a little bit experienced about how you do it, because you could wind up with polka dots, which is not a good look. And this is not the type that you would use on your face. You could use these on your lips though.
So what are you doing with, wait a minute. Okay. What are you doing with, what does it do exactly?
Okay. So, very interesting. Usually when we think of massage therapy and things like that, we're always pressing and digging into areas, right? So we already have an inflamed area. Now we're pushing and digging into it can cause even more inflammation. The concept with cupping is quite unique because it's the reverse of that. We are taking blood, muscle tissue, and we're pulling it away from the insertion and origins of bone. And we are bathing it in brand new blood flow. We're taking the stagnant blood, we're pulling it to the surface. And because of that change there, it signals the body to put new blood into that area. So it detoxifies. Long ago, we would use cupping for tuberculosis. We would do treatments over, especially the paraspinal muscles. They correspond, if you think of the kind of spinal nerves, to each organ as you go down the back. So we have like our lungs, our pericardium, our heart, our liver, our spleen, our kidneys, as we go down. So you can leave these in place and therapeutically affect the nerves that are innervating those organs to get a treatment for those organs as well. It helps for new cell generation. I said it detoxifies. Now, what happens with cupping, if you left them in place, stationary cupping for 15 minutes, you pop them off, you might have marks, right? So you might have seen this from time to time on people's backs or on their bodies. Large, look like pepperoni kind of shaped marks. And the marks are indicative to us of the stagnation. So, you know, they come in all colors. Purple is extremely stagnant blood there. So we would say, wow, you're probably having sharp pain. This is a dysfunctional area, and you're having a high degree of stagnation in this area by the way that those marks look. They could be red, which shows a little bit of more heat, or they could be light pink. They could even be deficient. And ideally, what should happen when you do this often enough is that your muscles are going to be bathed in such a nice new source of blood that you're not going to really have marks left over. So in the beginning with cupping treatment, you might be really shocked at how purple and dark your marks are. And they last anywhere from like 3 to 7 days. Typically, we don't really go right over the same mark again until they've resolved. If you're going to do it at home or anything like that, you never want to do it on broken skin. You never want to do it, usually on children under 10, don't want to do it on pregnant women. Some little contraindications, not necessarily the best thing to put on your jugular, although it probably wouldn't be, too dangerous, but so very beneficial.
You have the small ones as well for your face, because I've got all.
I do.
Yeah,
I do, and they're like a little bit of a softer plastic. You can see this is pretty thick with the silicone. It's a little bit of a softer plastic. They're smaller. They're a couple different shapes. But I'll tell you, I think the gua sha is actually more effective for the face if you're going to do facial rejuvenation, and I'll show you that too. It's, again, kind of helps for circulation, immunity, new blood flow, detoxify. But the gua sha is really cool. So I don't know if you're familiar with gua sha tools. You spell it Guasha. So they come in a variety of shapes. We have one that's like a horn made out of different materials. Some are plastic, some are actual horns of animals and things like that. The Chinese like to use everything. Anyway, so this is also great for pain. So
what do you do with it?
Well, I'll show you.
Oh, please.
So typically, similar to cupping, gua sha translates to scraping sand. So sand is indicative also, just like the cupping leave marks, gua sha can leave marks too. And what it looks like is a petechia, kind of almost like a raspberry type of blood cells that come to the surface of the skin. So typically we use gua sha for pain as well. This is wonderful for if you have.
Go down. So I never heard of the thing. So
okay.
Need to understand what you're saying here. So
okay.
It's different shapes, right? And I don't even know what you do with it.
Mm-hmm.
So battery. I don't.
And these are also very, very inexpensive if you want to order them on Amazon, whatever. They're different shapes because you can use them in different areas of the body, and depending on how long you have to hold it, what's more comfortable. Every side of a gua sha tool can be used for different areas of the body. So for the face, I'll start there. For the face particularly, what it's going to do, again, is detoxify. It can even extract or express, you say if you have blackheads or things like that, It's very good you want to heat up your face, nice hot cloth, make sure you have nice clean skin. You're going to, again, apply some good oil, whether it's grapeseed oil, coconut oil, whatever your preference of choice. You're going to use the tool. Let's see, I want to use this one, say. Typically in gua sha, if we're treating pain throughout the body, we always move in a downward direction away from the heart. And we think that is to get rid of old stagnant blood away from the heart, push it out and allow new blood flow to come in. In terms of the face, you want to use a more spreading, opening, and lifting technique. So with gua sha, wherever you're using it, it's a repetition of movement. With a good pressure, you're using an edge, you're scraping. So you could do this, 15, 20 times in one area. You're going to move down your entire face. As you move, you can use all these little different sides for nooks and crannies. You can go under the eyes, lift up, again, here for the jawline. Be careful as you go, though. Like, you don't want to do this the day before your wedding, and come out with like a bright beet red face. Same thing like the cupping. You have to be careful. You don't want to leave marks on your face. So as you see, and you could stay on a wrinkle and you're going to see it immediately get red right where, you have that line. You just want to back off. The best way to do this is with repetition and make it a part of your routine. You don't want to go to town one day where you're like blistered up and crazy and then not do it again for a month. You're better off doing this like 5-10 minutes every day before you jump in the shower or something like that. Really, really amazing. Better than the cupping for your face if you're talking about rejuvenation. But if you're using this for pain, it's wonderful. So say you're having bone spurs. Bone spurs is another thing that part of a degenerative condition. Western medicine doesn't really have much they can do for it. Sometimes they go and cut them off and they grow back. And also in your body's wisdom, bone spurs happen because the body is signaling the brain that bone is getting weak. It's, kind of breaking down. So it's sending the signal to the brain, hey, make more bone, so there's, increase of the osteoclasts, osteocytes, all that good stuff. Unfortunately, as it grows in these little jagged ways that either push on nerves, cause inflammation, and also become a new, painful condition, whether it's plantar fasciitis of your heel, whether it's happening in your spine, which happens a lot in the neck. We call it autofusion, where you actually see these bone spurs starting to connect the vertebrae because it's getting weak. So now it makes it strong. It's like, oh, great, my neck is strong, but like now I can't barely move, So what you would want to do is, again, you'd like scrape along the spine, the shoulders, painful areas. Wonderful. Good.
What are you targeting exactly with it? I mean, is it the blood flow? Is it, that's what I'm trying.
So it depends on where you're using it. So say you have degenerative changes in your fingers. Say you're having hand pain, arthritis, maybe even, changes in the joint and some deformity. We can use some of these that have these little nooks and crannies and literally scraping the joint. And dig. You could also use this for the acupressure that you were talking about, where you would use a point to dig into an acupoint to get a certain kind of stimulation. But what you're looking for is kind of, pushing new blood flow to the area. Very similar in physical therapy, just developed recently. They call it the Graston technique. And Graston technique, I say they're reinventing the wheel because they have these fancy stainless steel tools. They cost about $3,000. And they do the exact same thing. And honestly, you don't even need to buy these tools. You could probably find something in your kitchen drawer, like a rice spatula, or you can makeshift this. Wonderful for lymphatic drainage also. So when we talk about detoxification, when we talk about, again, just ridding area of old stagnation, whether it's blood flow or lymph, and replacing that with new blood flow. Tremendous results if you have tendon and ligament injuries, partly because tendons and ligaments don't have a good source of blood flow. It's a different type of material. It's not like a muscle. It's not bathed in blood. Blood is like the fountain of youth. blood will help regulate and restore the function. So this is why tendon and ligament injuries take so long to heal and can be so incredibly painful. So again, these tools are quite amazing in directing new blood flow to those areas to restore and regain function and reduce healing, you know, make you beautiful. And
Jeffrey asks, any suggestions for relieving fibromyalgia?
Yeah, so acupuncture is a wonderful, kind of adjunct to that kind of therapy. Basically, you're having an overactive nervous system that is signaling pain all the time. They used to call it the waste bucket diagnosis, right? So it was like you went through everything else, and then finally they're like, maybe it's fibromyalgia, right? So it's a complex pain disorder, and wonderful. For the endorphins and the serotonin and the good night's sleep alone, it's beneficial. My thing too is sleep is so important. If I can reduce stress and regain a good quality of sleep for a patient, that can be huge. Sometimes you don't realize how, a dysfunctional pain or sleep pattern contributes to your pain. So yeah, wonderful. I have a lot of fibromyalgia patients that do great.
How about lymph problems? There are people, and also lymph drainage.
Yeah, sure. So, in swollen limbs, things like that, I can needle all around an area. It's very interesting with Chinese medicine. Aside from going into a contraindicated area, we have things called ashi points, which I stick to, my regular, there's almost 365 points on the meridians in the body. But as long as I'm not doing any damage or going in directly into a nerve, we have kind of free range to go to areas of pain, swelling, or dysfunction. So, and I actually, in my experience, find those points to be the most effective. If I have a point here, that's a classical point, and a point here, but the patient's pain is there, guess where I'm going? I'm going, right to it, and get that result. So for lymphatic drainage, this is wonderful. Definitely, Epsom salt baths, things like that. Heat therapy is good. There's massage therapists that specialize, in lymphatic drainage. That would be another option. There's body brushing. You probably know about that, right, Keystone? Yeah. So those are all very good for lymphatic drainage. Diet too, very important.
Yeah, it's of all these things, and I like that you do all these things, and there's so many modalities in healing, and everybody can use one of those, hence why I want to have the website where you can also give advice, because obviously you have a practice where you need people to see people, and obviously you are where are you living?
I'm in New Jersey now.
Okay, so then people are limited, obviously, to that.
Sure.
But for information, that's you're a great source for that as well on the website, which will come. And so, hence why.
Yeah, I'd be happy to help in any way.
Yeah, because, this is why we need to start this website for everybody to access, to be able to get information on whatever can help them, because, only with knowing how things work, because we can hear acupuncture, but we don't know, many people don't know exactly what it entails. What does it heal?
Sure.
Target. And the same with cupping, the same with all these things. And, so obviously, advice is always great to have. And that's this is what we need on our website for people, and obviously there's many more that will come. I see magic, I can never pronounce your name, but he's talking about the Wim Hof method. Is a Dutch guy who does the ice. He's called the Iceman. I might actually ask him on. He lives in Holland after all, and see if we can have a talk with him as well. Anyway,
that sounds cool. Yeah. I never heard of that, but there's, yeah, so many different modalities, and to have that community together, you know, a healing community, we can cover a lot of bases between everybody that participates, because acupuncture isn't for everybody, you know, and I'm not here to tell people otherwise. I see particularly the best results, like I said, musculoskeletal pain, headaches, migraines, particularly. Usually I call it my headache or migraine special. We could get that gone while you're on the table, usually with pain, depending on the condition. I want patients to feel something right away, regardless. They're leaving my, table, whether they feel reduction of pain. A lot of them feel high, something. You should feel something change. I've had such wonderful feedback from patients, just brought to tears. That just makes my heart sing. And I always say it's your body responding, but immediate results, definitely. Sinus issues, headaches, migraines on the table can get that. I've had teachers all along that said acupuncture can be emergency medicine. We have, points that can revitalize and bring you back in emergency. One quick tip: think you're having a heart attack, is to bite your pinky finger. It's a heart meridian, things like that. So fertility is a big one with acupuncture, whether you're going through assisted reproduction or trying naturally. Acupuncture, again, because of regulating blood flow to ovaries, uterus, having an effect on normalizing and balancing a hormonal system, you're going to up your chances by 60% with acupuncture. So for those areas particularly, very, very effective.
So what about lymphedema?
Lymphedema, yeah. I mean, it can be a little bit tricky because patients, almost like the cellulitis, get a little nervous of like, wait, you're going to go near there? But I do. I would treat the area, help restore, a normal blood flow and energetic flow. Usually a lot of times with the excess fluid, there's such stagnation. And again, I look at the deeper issue. We talk about dampness, going back to the spleen. We're talking about muscles. We're talking about fluid leaving the vessels. This is all spleen issues. So we would want to fortify and tonify the spleen in that as well, and then also treat locally. And that's the thing too, is we always want to get to the root cause of issues, and that's why the diagnosis is so important. Typically, diagnosis in Chinese medicine involves a pulse diagnosis, and we look at the tongue. So the pulse diagnosis will give us information on different organ systems. We have typically 28 ways to describe the pulse, which gives us an idea of what's happening in the internal landscape. And same with the tongue. It relates to different organs and how they're functioning and the overall state of the body, whether there's heat, dampness, phlegm, things like that. Also, I use a lot is the electrical stimulation. So I think the electrical stimulation on the needle is very effective. It can make for a much more powerful treatment. It can certainly trigger more of a release of the neurotransmitters. And what we think it does is also intercept the nerve pathway perception of pain. So even, going back to the fibromyalgia, things like that, the body's in this cycle where it's just getting hit constantly with that nerve impulse of pain. And we want to kind of upset that rhythm. We want to, interrupt that pattern.
Right.
So yeah.
If you have like a client, patient, I don't know what you call them in your case.
Patient.
Okay. So then you use all different modalities, depending obviously on what somebody has, and then you go from there, and then you use all those.
I do. Really based on what the patient needs. Sometimes too, like for a first treatment, I might not do the stim because some patients are very responsive and sensitive. So it's my job to figure out how they respond to treatment from the first almost to the second to the third treatment. If they're not progressing the way I want them to, I need to step things up on my end or change strategies. So it's important to gauge because everyone's so different,
Yes.
You have patients, it's amazing. I have patients, I can literally put 50 needles in. They're like, are you going to start? And I'm like, you got about 50 needles in you. And then I have others that giggle, they giggle and laugh. Oh, it tickles. And then you have that one that's like, oh, take it out. And it's like, stop. I'm very gentle, Keystone. I'm very gentle. Well, and listen, I always tell patients too, needle phobia is a real deal. It's not like you have a fear of rabbits or pennies. It's needle phobia is a real thing. And as far as we know, needles are sharp and they hurt. We don't like them. But it's not like a shot. It's not like an injection. It's not like anything you've ever experienced before when you think of a needle or an injection. I had one patient say, you should call them threads. You shouldn't even call them needles. Like, it's such a disclaimer, it doesn't really give the sentiment of what a needle feels like or what the sensation feels like. So,
well,
good.
Enough. So I don't have needle phobia. It's just that I had one in my ear, which was smoking, but it hurt so much. I just couldn't cope with the pain. But it is known that redheads are much more sensitive to pain. And
that's true.
And it's true, because seriously, for me, everything hurts.
Well, so interesting you brought up about the ear. So the ear, we think, is a microsystem unto itself. So within the ear, you almost have over 300 points alone on top of the body points. So their location close to the brain, they trigger the release a lot of the neurotransmitters. They are very powerful points. And in fact, you might have heard of acupuncture anesthesia, not widely practiced in the US. It's quite interesting, though, because I see a lot of insurance companies where the acupuncture won't be accepted or covered unless it's being done for acupuncture anesthesia. And I'm like, who in the world is getting open heart surgery in the US? And they're like, you know what? Let my acupuncturist, needle me instead of anesthesia. Kind of crazy. But typically what they would do is they would hook it up to your ear with the electrical stim. And because, again, they're so close to your brain, the triggering of those release of those neurotransmitters, very powerful. Just like you said, stop smoking. We have the NADA protocol in the ear, which is stop smoking, drug detox, weight loss, things like that. I mean, you could treat everything. You could treat back pain. You could do everything in the ear and just use that as, kind of strategic point selection. And again, because they are powerful. But like the vagus nerve, one of the great point in the ear, I know you were talking about the vagus nerve the other day. It's actually the hard point in the ear, and kind of just reboots everything. It's wonderful. It's like hitting the reset button. So now when the needle was in your ear, did you tell the person that it hurt and it was uncomfortable? Or did you just try to tough it out?
It was in my ear.
I know. Did you tell the practitioner it was painful?
Well, actually, I pulled it out myself.
It shouldn't be painful. So you can feel some more than others, but we could have easily backed it off a little bit where you would have been like, and I'm always like, better, worse, same. And they're like, better. I don't feel it anymore, without taking it out. But I don't blame you, if you need to take it out.
Painful. I was just like complete. Everybody was sleeping because
everyone's all zenned out, and you're the only one like, bow, bow, bow.
And I was done.
You were done. Yeah. In fact, actually, in some states, it's mandatory for prison charges. If you've been arrested on a drug charge, part of the rehab was that prisoners had to go get ear acupuncture. And they didn't have to receive it, but they had to go to the appointment, and then they could opt in whether they wanted it or not. And most of them are like, heck, what else are we doing? Might as well get an ear acupuncture in prison. And they found it to actually be very effective. So,
but you guys don't have acupuncture in your insurance?
A majority of my patients do. So New Jersey is one of the best states for acupuncture coverage. We have Horizon, Blue Cross Blue Shield, a lot of our teachers and federal workers, direct access, things like that. I see Aetna patients and Cigna. And actually, believe it or not, Medicare has now just approved acupuncture, which has been this has been going on for years, where we've been fighting to get this because it's an aging population, which we can do so much for to help, and it was never covered. And I would treat Medicare patients if they had a secondary and it was covered through there, but they've now just picked up, and the problem had to do with Medicare being a federal system, didn't recognize acupuncture in some states, So if it was allowed in some states and not in others, it couldn't be a federally, funded program. So they just kind of gave us the boot. And actually, it's not as simply solved yet because they still don't really quite see us as providers. I might be in a unique position being that I work with orthopedic surgeons that we could probably do that. But for the majority and the layperson, they haven't made it quite easy. But they're looking for low back pain, 12 treatments, with progress and approval of another like 10 to 12 more or something, which is better than nothing. So insurance is definitely picking up. Depends on the state. It makes it easier. I usually tend to recommend 3 times a week for 4 weeks. That would give you 12 treatments. That's considered one course. So when you don't have the insurance benefit, it can be quite costly. In which case I always tell a patient, is once a week better than nothing? Yeah. And expensive related to what? If it was your car, you'd fix it, so it varies. But it's wonderful with the insurance because patients can come at a frequency and really see the best results. You're going to see the best results in the beginning. You're going to make the most progress in the headway. Ideally, you want to take it to more of a maintenance treatment, where meaning you're coming in seasonally, maybe once, every couple of months, as needed to prevent, things from happening, again, or where they were at. So.
Right. So now you covered quite a lot in an hour and quick.
That flew by. What else do you want to talk about?
Let me do some questions here. So Judy asked, do you dabble in the metaphysical aspect?
I certainly do. In fact, I want to become a ordained minister. I think that'd be cool. And they can call me Dr. Reverend Rook. Everything is energy and everything is a frequency and vibration. So acupuncture actually is energetic medicine, which is super cool. When you think of how to produce an electrical charge, we have a coil with a rod through it. And that's exactly what an acupuncture needle is. So my most important thing for me is to maintain my energy vibration. I have to be high vibe. I see a lot of patients every day that are not. And it's important in terms of that exchange. I also pray over them. Jesus is my wingman. So I pray over them similar like White Hat, with the authority and to command. So the authority to remove disease and to command to make what's whole or to restore, what is broken or diseased.
So it's Brandy here today, but her daughter who went to the and feel her legs and eventually she came home, but she's not able to move her legs anymore. And there's Brandy, there she is. And she told me about it, so I told her that we're all going to pray for her as well. And
how did she lose feeling in the legs? I didn't hear you.
Brandy told me about it today, and I don't even know if she has the results yet, because they did go, but she didn't have a diagnosis yet.
Okay, so she just woke up one day feeling numbness and no feeling in the leg. Your mic is breaking up, Keystone.
Is it?
Okay, better now.
I think it's your.
I think it's my buds.
Yeah, again.
Okay, sorry. Okay, so routinely blood work would be recommended. Is that what they did? We want to rule out all autoimmune stuff. If there's no traumatic injury.
I don't know. She's not responding at the moment yet. Oh, here.
Okay.
He's woke up that way, and they still don't know.
Okay, so it's hard to say without knowing more information. But if there's a back injury or something like that, we could maybe look to spinal issues. If it is out of nowhere, out of the blue, we want to rule out things like MS and other autoimmune issues. It could be just something like a diabetic neuropathy, depending on, how severe. It's hard to say without the information. So blood work is a good first approach,
Okay.
That being said, knowing more information and what path you follow, could acupuncture help with that? It's quite possible, regardless of whatever the diagnosis is.
Brooklyn asks,
What's up, Brooklyn?
how many people do you treat for TMJ?
Oh, TMJ, that would respond very fast. I see a lot of those. I even can get them even when they're face down in the cradle and still get them because, yeah, we got my clenchers, all my white knucklers. Yeah, no, it's actually very effective.
Too.
What's that? You have it too?
That's this, right?
Yeah. So, we see that with a lot of stress disorders and also teeth grinding, things like that. So you're like, check.
Yeah.
It's phenomenal. It's phenomenal with that. I use a hydroculator, so I have hot packs and cold packs, which I only use seldomly. We're big proponents of heat, but I do find them to be used appropriately at times. And I would do the heat therapy with that. I would also do massage therapy. I'm blessed to work with a licensed massage therapist. So not only do I have kind of my tools up my sleeve, I work with her, and between the two of us, just great things happen. So massage therapy for sure. The gua sha would be beneficial. Dig in there.
Yeah.
Definitely. It's something you could do at home.
Yeah, I used to. I was a massage therapist as well, but yeah, it's just natural Indonesian hands,
Oh, nice. You want to walk on my back?
You want high heels?
You're gonna put holes in me.
Cindy is actually saying that her granddaughter is only 2.
Mm-hmm.
Wow, that's so young. Anyway, so yeah, no diagnosis there, so we cannot know.
This is the baby is 2 that doesn't have feeling in the legs?
Yeah. Yeah. Anyway, so
that's interesting.
Is there anybody else that still has questions for Rook? Okay. Can you ask Rook if? Yeah, it helps with migraines for sure. Right?
Almost instantaneous.
Yeah.
So on the table, in fact, I always encourage patients, like, as long as you can get there safely. Like, I don't want to put somebody out in the car and drive if they, can't drive during a migraine. But if you can get to me safely during, a migraine, I almost can guarantee you're going to leave without it.
Wow. I used to wind up at the ER with my.
Oh, they're debilitating.
Yeah.
Between, the sensitivity, the nausea, it's awful. So, yeah.
So, any other questions here? Let me see if I skip some people here.
Hi to everybody in the chat. I couldn't really multitask, so all my besties and cutie pies out there.
You cannot hear me, can you?
Yes, I can.
Oh, okay. So, does ultrasound work in a similar way?
Ultrasound helps for inflammation. So it's a little bit different. And ultrasound can be effective. I work with physical therapists as well. So we have ultrasound machines and it's routinely done. It would probably just be another modality. It's something a little bit different.
Okay. Let me see if I can find some more questions here. Ladies, what do you think of the collagen craze? I don't know what that is.
People are taking it in shakes or just as a supplement, collagen, to restore youthful skin, things like that.
Yeah,
I would say be careful of the quality of the collagen you get. You got to do your research.
I think you can stimulate your collagen the way I do it with the microneedling.
Mm-hmm.
So, but no, I'm not a fan of taking all that stuff. I don't even think that really hits the spot when either it's with creams or stuff like that.
Mm. Well, it's like glucosamine too. That was a big craze too about restoring the cushion and, kind of cartilage within your joints. You want to use chondroitin and glucosamine and things like that. And not 100% sold. I mean, is it going to hurt? Probably not. But again, you got to be careful the quality that you're getting.
Of course. Yeah, I see everybody selling that stuff now as, on their YouTubes. And
Yeah.
I'm,
Collagen is a sponsor.
yeah.
Mm-hmm.
So, is it dangerous? That's a question from me. Is it dangerous to do certain things for yourself? Like you say, the cupping, obviously, you gave information about that, but, so are there certain risks where you definitely should watch out with?
You have to use common sense mostly. Like I said, you would never want to go on a broken skin area, whether you're doing gua sha or cupping. If you have a rash, you don't want to do it. If you have marks that are left over from the previous treatment, you wouldn't want to keep going at it. Any kind of opened or bruised skin you want to avoid. We used to have a thing about cupping over the internal organs and to use caution there. And we used to have a technique that we would do. It was called popping cupping, particularly for weight loss and for stretch marks and cellulite. And we would literally put it on and pop it off very fast with the fire. And it would be a quick tonifying, almost like micro treatment to get blood flow and circulation. So I would say over the vital organs, be careful of a suction lasting longer than 15 minutes. It should not be sharp. It should not be painful. There are times in cupping treatments where they intentionally leave a cup on and you actually get water blisters. And we think that's leaching dampness out of the body and it's considered a good thing. It's not pleasant at all because those tend to scab over and don't look nice and can be kind of painful like a blister. So I would say just avoid going for too long. You want to do 15 minutes is probably your max in one area. But for the most part, no. As you see stuff come up on your skin, you just want to ease up a little bit. It's once you get a hold of it, actually go on YouTube and Google gua sha for facial rejuvenation.
Yeah, links below in the description later.
Yeah, I could even put it in there now, but like cupping therapy, silicone cupping, this is a silicone cupping set, therapy for pain, whatever your concern is, what you're looking for, gua sha for plantar fasciitis, things like that. So.
Right. And Whitehead, everybody was asking for your Parler, which I now put in. It's
Love Reigns. Somebody took Rook Castle. Go figure. I mean,
well,
I'm at Love Reigns Rook Castle, but somebody's Rook Castle at Rook Castle. And I've been on for a little while. I just couldn't get it.
If you put it in like with the ad, you can't find it. That was really strange. But just with Love Reigns, I could find you.
That's weird.
That was really weird.
That's weird. Yeah.
Still a bit.
Inevitable ET went down today on Twitter. I don't know if everyone saw that.
Did he?
Yeah, the Punisher tweeted that like, no. Mm-hmm.
And not long ago because he was on.
I think right before we came on.
Let me see. Hyperthyroidism.
Hyperthyroidism. So hypofunctioning of the thyroid. So a lot of people were using Armour thyroid and non-synthetic versions of Synthroid. I'm not sure if you're on Synthroid or not. I would say even considering doing the hydrocolon therapy that Keystone was talking about would probably be beneficial. And then really working on the metabolism, fortifying your body, astragalus, things like that. Again, for herbal formulas should be really modified and very specific for an individual. So it's hard to do recommendations without knowing the full picture.
Right. So, okay, now let's check this out because, yeah, today a lot happened on Twitter.
Yeah.
And I found a new way to communicate, which is upside down.
I love that. I retweeted that. I didn't get to do it yet, but I love that.
It's upsidedown.com. No, upsidedowntext.com. And yeah, works like a charm. I'm actually very surprised I'm still there. I'm surprised that actually methods, how he is really continue sticking around is beyond me. But yeah, anyway, yeah, well, obviously we're all are about to go down apparently. So
Well, but it's interesting because it's brought such awareness. So
yeah, I think
it could actually backfire.
people wake up to it because now all over the world in the
Yeah.
news channels they're all talking about Q and our favorite anon, like, and obviously people are going to search for it, and there's
Right. Like, what is this?
yeah,
You know? And everyone's been coming to everyone's defense because I love how they just try to throw everyone under the bus and say it's a hate group and far right. It's anything but,
yeah, this
you
is
know?
again a divine intervention. Speaking
Hmm.
I had my interview yesterday with Enlighten podcast, which was very interesting because I shared my personal story. So for people to see it, I will well soon. It's just a question. Ban EU. What does tech? I don't understand what you, Yolanda.
Say it again.
Yolanda asked on the shadow ban EU. What does protected mean? I don't know.
I think she's talking about the settings under Twitter when you search a person and it gives you the breakdown if they've been shadow banned or ghost something. And then it was like, if it's checked, you're not, but if it's red, you are shadow banned. So just blatantly showing that they do this, intentionally. I don't know. That's my 2 cents.
Protected would mean that
It's not happening to you.
yeah, you're safe.
Yeah.
I'm glitchy. I hear I'm glitchy. Is that my microphone again? Sorry.
I thought it was my earbuds that were the glitchy one. I was going to come out in a robe tonight, a robe and pearls, because I want to introduce my new channel, which is Bath Time with Rook Castle. And we're just going to take bubble baths. You know how it's like dark to light? It would be dirty to clean.
Yeah.
Right? And so we'll just take bubble baths and chat, the news of the day, talk about maybe some essential oils and,
Yeah.
Epsom salts and whatever else.
The Q bath.
The Q bath. There you go.
Let me see. What does protected mean? Yolanda, protected means, if you can hear me, hopefully, that you're okay. There's nothing,
That you're not being shadow banned.
Not shadow banned. Brandy says that she can't hear me. Do I have a problem with my sound, guys?
I hear you now.
All right. So, yeah, people, please consider to donate. Obviously, we have the usual suspects in here, so people already donated, cannot ask. But yeah, guys, we need to start this channel, website, because very important. We're going to have Yolanda on as well. She does Reiki and other things she will be talking about. Yeah, that will be happening soon as well.
Someone was asking about their kidney function. So I would say be careful of the amount of calcium, phosphorus, and nitrates in your diet. There's definitely fortifying foods that you can look into. Acupuncture would be wonderful for that, and herbal medicine. I'm not sure if it's filtration, what stage, what's happening, but definitely something for Chinese medicine for sure.
So people tell me if your dog is barking, they can't hear me.
My dog has not been barking. I mean, he's usually obnoxiously barking, but
Well,
did you guys hear him bark?
there was a dog.
Oh, now he's barking. Great. That's Puffy the Vampire Slayer. He's a force to be reckoned with.
Well, that's weird. It takes over somehow the sound.
Hang on. Bella, put him outside. Put him outside. He's going to the backyard. He's being removed from the building. He's a menace to society. It happens all the time.
I've been bugged by a dog.
Been shadow banned by a Pomeranian.
Oh, God, they're so silent.
My daughter wants a pug, though. So.
Yeah, it was a pug. I guess Whitehead is infecting everybody with a.
That's right. Ruby and even Adam hug a pug. Yeah, she's pug crazy.
Yeah. Okay. So, yeah, we because there's another thing. I want to shorten my Wednesday episodes because I have a 2-hour show usually, and everybody was screaming for my detox episode. It's the least good
Stop.
video. Obviously, the internet wasn't very well that day either, so that may be the reason. So maybe I need to do it again. I don't know, but yeah. So and I wondered if that maybe might be because 2 hours may be too long. And
What?
on soon.
I was gonna say you could have White Hat on after he does his hydrocolonic.
Well,
He said he's gonna take pictures for us.
but that will take a while because you need like several sessions. It takes over the span of, I guess,
6 weeks or so. Yeah.
we want
Okay.
earlier, obviously. So it's got more.
It'll be the sequel of the detox show.
Yeah. Well, we could. We could. Well, that would be cruel. Anyway. Well, Whitehead has a lot to share still about the health and obviously sport, but also the that.
I like to tease White Hat.
No, we won't do that to you. You between all of us,
Honestly, but White Hat is such a blessing to our community. It's just amazing to, have an opportunity to get his insight, and so happy with the show.
He makes everybody happy with his voice.
Everybody's happy with that Southern drawl.
No, we're going to have Whitehead on soon again. I hope actually next week maybe, because I want to cover some more things regarding also diets, because he knows a lot about that. And so as long as not just chicken and rice.
Or wings and pizza.
Yeah. Rice or hamburger. But yeah, so that's going to be fun, and obviously it's always fun. I mean, really, it's fun to have anybody actually here as a guest because we're all one big family, so that's great.
Well, it's not only fun to be a guest, but it's super fun to be in the chat, and it's fun. It's always a fun time.
Yeah, I love it too, and I can't wait to go on Whitehead show. But I have to wait for Red Pill and Methods first. So until then,
yeah.
Invade his channel.
Yeah, he said that he was like, compared to them, the JV team, I'm like the freshman bench. We just sit out, just watch. It's on the sidelines.
Where can people find you? Do you have a website?
I don't have a website, but on Twitter, you could direct message me is fine. If you have any questions or anything. That's, Rook Castle.
Yeah, or in the chat.
Rook C1. Or in the chat, of course. I'm always around. You can always catch me around. And love to all the lurkers. Anybody lurking in the chat. I love the lurkers.
Me too. Yeah, Rook is our other Kate Awakening who is always bantering.
Oh gosh, if the three of us got together, I think we could really get into trouble.
Yes, and then there's Elise Brown. That's another one. She's also...
Kate is so funny. One time I was just in a chat with her and I just couldn't even keep up. It was hilarious. Hilarious.
Oh, you're going to love it. Anyway, so for today, I guess we're sort of done. It's like 1.5 hours. We have seen her face.
Pretty good. We came, we saw, we did. Dutch.
Yeah.
Do you mind people calling you Dutch? I think it's super cute.
Yeah. Oh, actually, that nickname I've got in. I mean, I think Kellyanne for Hub News started with it, and ever since it spread like a oil,
like wildfire.
So now I'm Dutch.
That's okay. I'm Rook.
Problem is, it's like calling somebody American.
Hey, America.
No,
hey, American.
Because every Dutch person is Dutch.
True.
So now in the chat, it's like, hey, Dutch. And all the Dutch people are all
like, hey.
I love the nickname. I love it. So, yeah, is there anybody else that still has questions or anything to say that we could shout out here for all the people to hear? No. It's always the delay. It ain't nothing but a montage. Clint.
It's a montage because you ain't gonna watch the whole damn thing now. That's iPod.
It's different. Yeah, I love iPod.
Oh man, I laugh out loud. Literally, I've caught myself talking to the video.
His creativity in the way he presents is
unbelievable.
He cracks me up every single time, and
absolutely.
Without any mistakes, no no nothing. He just goes.
Yeah, just flows.
Oh,
yep.
To ask my first name, well, I can actually refer you to all my other videos where it is mentioned. So
it's been revealed. It has been revealed.
Has been revealed a lot of times. No, it's
yes.
My name is Patricia. So that's another video where every single time I hear it, and then I know they haven't seen my videos. Doesn't be here, John. Anyway, so Dutch is easier to write than Keystone. Yeah.
Yeah, I just do TKC sometimes. She'll see you.
Yeah.
She's pretty savvy.
Think of Van Halen song when I think of your show. Really? How?
And which Van Halen song?
Keystone?
Maybe that's an obvious one. I'm not a big fan, so I wouldn't know.
All right. Oh, a White Hat is heading out. Bye, honey.
Bye, White Hat.
Was really great to see you here. Thank you. And well, we're gonna cut it off here too. Also, I need my sleep.
Yes, she does. And she's basically pulling an all-nighter.
Thank you everybody so much for being here, and I'm really grateful for you because this was really great, all the knowledge that you have. I didn't even know it was that extensive, and you can always come back again if people have questions or whatever and want to know more in depth specific things. So yeah, let's
Thank you so much. It's been an absolute pleasure. Thanks, Keystone. I'd come back anytime.
to all my mods as well, and everybody in the chat, and everybody that will watch afterwards will leave your questions or comments.
Yeah, I'll go back and read the comments.
Yeah, so if people have questions for her, you can leave them in the comments, and she will get back to you with answers. And otherwise, you can always check her out on Twitter.
Mhm.
And if we all get booted there,
On Parler, if we
and
get booted there, smoke signals.
I will put her handles and everything in the description, so you can immediately click that as well. However, the stream will be here, unless also YouTube is going to boot us. Let's hope they won't. So for everybody that's new, please subscribe, like, and get me over that 4,000 subscribers, because that would be exciting. And I'm going to wish you all a very nice night.
Good night, guys.
Good night, all. Bubble bath, girl.
Gonna hit the bath. Go get clean.
Peace out, all.
Love you guys.